Hello, I'm Dr. Care, and welcome to another episode of ToothsDay Truths, where I answer your questions on dental care based on over 40 years of experience. If you're enjoying these videos, please take a moment to follow and subscribe. Today we have another visit from my hard-body friend, Mr. Bony Maloney. Bony, what's on your mind?
What's on my mind? Nothing much. Seeing as I don't even have a mind, look inside. It's hollow up in there.
Good point. So the last time we talked, you said you had more questions about x-rays. Would you like to share those now?
Sure thing. So, I was wondering, when I go to the dentist, why do they take so many x-rays? I mean, they take one big one of my whole head, then little ones all over the inside of my mouth, and then they point that x-ray thing all over my face, and it looks to me like they're shooting x-rays at the same tooth over and over again.
Good question. Well, let's go through the different types of x-rays, and I'll explain them one by one.
Okay, Doc, I'm all ears. Well, I ain't really got no ears, but I'm all ear holes.
That's true. You know, without having any fleshy parts on your body, it's amazing what you can still do.
What's amazing is how I get these shaves to stay on my face with no ears to hang them on. But proceed with the x-ray play by play.
All right, let's start with the big x-ray. It's called a panoramic x-ray, sometimes shortened to the word panorex. It's often the first x-ray taken at a dentist office. It involves a large machine like this that the patient sits or stands at, and the x-ray beam travels around the patient's head while a sensor on the other side captures the images. Then the images are organized digitally to produce one large view of the patient's upper and lower jaws together. This allows the dentist the ability to see a number of things, such as impacted wisdom teeth, tooth and jaw fractures, developing permanent teeth in young children, bony cysts, some cancers, and a host of other things not visible in a smaller x-ray. It's often the first x-ray taken because it can also tip off the dentist where to take a closer look.
What's that closer look mean?
Well, for that, let's look at what the smaller x-rays show the dentist. The smaller x-ray images are of two types, a bite wing and a periapical. The bite wing gets its name from the way the x-ray was taken way back when film was used. The patient would bite on a little wing that was attached to the film, hence the name. The periapical refers to the fact that this image shows everything peri, which means around, the apex, which is the term for the end of the root of the tooth. Since they're aimed perpendicular to the biting plane, the bite wing x-rays are useful for showing cavities in between the teeth, as well as how deep those cavities might extend towards the tooth nerves. But they don't show much of the roots of the teeth. The periapical x-ray view shows the roots and any abnormalities, as well as cysts and abscesses that might be growing around the roots of the teeth. But they aren't very good at showing the depths of cavities because of the angle used to produce the image.
Okay, Doc, that's looking cool, man. Now, remember the last time I was here, I asked you about that 3D x-ray the dentist said I need to get for my implant. What about that?
Aw, Boney, once again, we're out of time. But you come back in a couple of weeks and I'll explain 3D x-rays for you.
Sure thing, Doc. I'll see you then.
So long, Boney. Remember, the information I provide should only be used as a guide and is no substitute for a visit to your dentist office. If you have any other dental topics you'd like me to cover, please just post them in the comments. You can find me on social media at rcairedds, that's rcairedds, at Facebook, Instagram, Twitter, and YouTube. Or you can email me at rcairedds@gmail.com. And please remember to like, follow, share, and subscribe. It really makes a difference. See you next ToothsDay.